So there are some questions that we forget to ask or we choose not to ask the doctor when we meet them in the OPD. Are these some questions that you wanted to ask or you forgot to ask? The number one question which we don't ask is should I stop smoking before the procedure? Now, many a times our relatives that come along with you in the OPD don't know that you smoke, but it is important that you tell the doctor, and you couldn't reveal this because there were people sitting around, and I would still want you to know. Typically, you should just quit smoking, but the second best thing is to stop smoking at least 2 to 3 days before your planned procedure. Now, when we smoke, the nicotine in the smoke causes the veins to go into spasm as they become tighter, and when we are doing the procedure or put a needle in the vein becomes fictitiously like small during the procedure itself and makes the procedure difficult. So if you do smoke, please stop smoking at least 2 to 3 days before the procedure. Number two question is the procedure painful? It can be a little painful. It is as painful as giving blood for a blood test. It is not magic. We need some needles, but it is not as painful as cutting or stitching. You would not be given a full unconsciousness. There would not be a needle in the back. There might be some sedation, some sleeping medicine, but typically doesn't require a full unconsciousness and is not very painful at all. When can I go back to work? Now that depends on what kind of work you're doing. If you are doing a sitting down job, that means you go to office, you sit down, do something on the computer, walk around a bit, then that's fine. You can do that. Again, depends from patient to patient and depending on the severity of your condition. If you don't have a wound on the leg or you are otherwise all right with your activity, then you can go back to work within 2 or 3 days. Some patients go back the next day as well, but in general, non-strenuous activity, that is an activity that doesn't require you to stand for a long period of time, or an activity that doesn't require you to lift heavy weights, can be done almost immediately. Typically, a patient goes back to their level of activity what they came with before the procedure. Another question is, how long does the procedure last? Well, I must have told this to you in the OPD, but let's do it again. You might have forgotten. The procedure takes around 45 minutes to 1 hour if it is for both legs, and it is about half an hour to 40 minutes if it is for one leg. And again, it depends on the complexity. It depends on the number of veins, it depends on the age of the patient, and it depends on what kind of medicines are required to do the procedure in terms of anesthesia. But fairly quick procedure in which you will be walking around immediately. How soon can I walk? Well, you can walk around as soon as the procedure is done. A very few patients require some unconsciousness, that is majorly not from the pain perspective, but from the anxiety perspective. I mean, it's like if I have to go through a procedure, like even if I go to the dentist, I get very anxious. It's not wrong to feel that, but if you are anxious, some anti-anxiety medicines can be given that might require you to rest for some time before you can start walking. But in general, patients start walking almost immediately after the procedure. In addition to this, if you have any more questions that you think are not covered either during the OPD consultation or right now, please put in as a comment, and I would reply and clarify. And if there are a lot of them which come up, I might as well create one more video. Thank you for watching.